In his latest daily address to the nation from Afya House, Cabinet Secretary for Health Mbagathi confirmed an increase of the number of cases that have tested positive for the coronavirus in Kenya.
We have received confirmation of one more case of a patient who has tested positive for coronavirus. This brings the total number of confirmed COVID-19 cases in Kenya to 16.
According to Kagwe, at least 646 people are now under surveillance after coming into contact with some of the infected persons.
96 of these contacts have already been released from our follow-up program after completing the 14-day follow-up period. Those remaining in our follow-up list are 550 persons.
In addition, 11 other cases that have been tested for COVID-19 are awaiting their results. Meanwhile, a government directive to have all persons coming into the country quarantined at their own cost got off a rough start after several of the passengers who jetted in were left stranded with no clear direction on where to proceed for the mandatory isolation. One of the groups spent the day shuttling back and forth between government facilities and private hotels.
We want at this point to issue an apology from the Ministry of Health and other government agencies that are involved in this exercise to the parents and the individuals who have been so inconvenienced since last night.
The government has now appealed to private hotels to consider charging lower rates to persons under mandatory quarantine and not to take advantage of the situation. Equally, the CS has termed as immoral a move by some Matara operators to hike their fares following a directive to cut the number of passengers per trip. The government is meanwhile working to ensure that anyone who has come in contact with the infected persons is traced and placed in isolation. The confirmed cases of COVID-19 in the country may be increasing by day, but according to the Ministry of Health, if you observed social distancing, this will break the chain of further spread. Matara, K24, Nairobi.